Welcome to This Explainer. Today, we're taking a behind-the-curtain look at the fascinating, highly structured, and, honestly, sometimes surprising world of clinical blood collection. What looks like a simple prick of the arm is actually a beautifully orchestrated medical procedure governed by intense science. Let's dive right into it. We've all been there, right? You're sitting in that clinic chair, watching the phlebotomist swap out those little colored tubes. But ever wonder what actually happens after the needle goes in? Or what's happening in the room before you even roll up your sleeve? There is this entire invisible world of chemical magic and super strict protocols happening during every routine clinic visit. And honestly, understanding it completely changes how you view a simple blood test. So, here's our agenda for today. 1. Safety and preparation. 2. The art of the draw. 3. The color-coded tubes. 4. How anticoagulants work. And 5. Phlebotomy complications. Section 1. Safety and preparation. The invisible shield. Look at the sheer specificity of the timing here. We all know hand washing is important, sure, but in clinical hematology, it's a rigorous protocol. When using an alcohol-based waterless antiseptic agent, you don't just rub your hands together and grab a needle. The guidelines explicitly state you must apply it to the palm, rub covering all surfaces of the hands and fingers, and then, here's the kicker, allow exactly 15 to 25 seconds for the hands to dry. That specific drying time is absolutely crucial for the antiseptic to effectively do its job. It's not a polite suggestion, it's a strict scientific requirement. And safety goes way beyond just hand hygiene. Technologists actually have to navigate this whole complex system of isolation techniques to protect both the patient and themselves. Strict isolation is for your highly contagious diseases transmitted by direct contact or air. But look at the variations here. Enteric isolation is for things like dysentery or salmonella, respiratory isolation for airborne infections, wound and skin isolation, and my personal favorite, protective or reverse isolation. This is used when the technologist needs to protect a highly vulnerable patient, like someone with severe burns or leukemia, from everyday pathogens that we might carry. It's a two-way street of protection. Section 2. The art of the draw. Calculated precision. So blood collection generally falls into two main categories. First up, we have skin puncture, which is often used for infants or adults with poor veins. This collects a mixture of capillary, venous, and arterial blood. Now, because bone injury is a very real risk, especially in tiny infants, these punctures must absolutely never be made more than 2 millimeters deep. And here's a pretty amazing fact. Just warming the site before a skin puncture can increase the blood flow 7-fold, literally 7 times. Then, on the flip side, we have standard venipuncture, which uses the evacuated tube system for larger volumes of blood. For this, the most common needle size used for adults is the 21 gauge. And speaking of that venipuncture needle, precision is everything. When inserting that 21 gauge needle into the arm, you can't just push it in arbitrarily. The needle must be positioned bevel up, and it should make an exact 15-degree angle with the arm. Not 30, not 45, but a shallow, highly controlled 15 degrees to slide perfectly into the lumen of the vein without piercing right through the other side. Now, the crucial point is getting the blood flowing safely. To do this, a tourniquet is applied to make the veins pop. But there is a massive, incredibly important rule here that you might not know. The tourniquet should not be left on for longer than 1 minute. Leaving it on longer causes blood pooling and hemoconcentration, which can completely skew the patient's test results. 60 seconds. That is all the time the technologist gets to find the vein, prep, and get that needle in at a perfect 15 degrees. Section 3. The color-coded tubes. Chemical destiny. All those cute, brightly colored little tubes? Yeah, they aren't just colored for fun. Each specific stopper color actually dictates a unique chemical destiny for your blood sample. The color is basically a code that tells the lab exactly what chemical additive is inside, which completely determines what kind of testing can be done on that sample. And because these tubes contain some pretty powerful chemicals, they have to be drawn in a highly specific sequence. It's called the order of draw. If you draw them out of order, the chemical additive from one tube can literally carry over on the needle and cross-contaminate the very next tube. The order is absolutely critical. First, you draw the yellow blood culture tubes because they're sterile. Second, the light blue sodium citrate tubes for coagulation tests. Third comes red or gold serum tubes. Fourth is green for heparin. Fifth is the famous lavender tube containing EDTA for hematology. And finally, the gray tube, which contains a glycolytic inhibitor to test glucose. If you deviate from this exact order, you risk ruining the patient's data entirely. No pressure, right? Section 4. How anticoagulants work. Biological magic. Normally, when blood leaves your body, it wants to do exactly what it's designed to do. It wants to clot. But a clotted blood sample is totally useless for a lot of lab tests. That's why we use anticoagulants. An anticoagulant is just a chemical substance added to the tubes that actively prevents blood coagulation. You can think of these additives as little chemical thieves. They intercept the body's natural healing and clotting processes so that the blood stays perfectly liquid for the lab machines. Let's look at how the big three anticoagulants actually pull off this chemical heist. In the lavender tube, we have EDTA. Its mechanism of action is that it chelates, or binds to, the calcium in the blood. Since calcium is an absolute requirement for blood to clot, stealing the calcium keeps the blood perfectly fluid. Then, the light blue tube uses sodium citrate. This also binds calcium, but it does so in a slightly different way that preserves the coagulation factors, making it perfect for clotting studies. And then we have the green tube, which contains heparin. Heparin takes a totally different route. It acts as a natural anticoagulant by directly interacting with antithrombin 3, which inhibits the formation of thrombin altogether. But guys, this is a delicate balance. The ratio of blood to these chemicals has to be perfect. For instance, if a phlebotomist underfills a lavender tube, there will be excessive EDTA relative to the volume of blood. The result? That excessive EDTA will literally cause the red blood cells to shrink. This leads to a decreased hematocrit reading and a falsely low ESR, which stands for erythrocyte sedimentation rate. Literally, one tiny error in blood volume completely alters the microscopic reality of the cells. Section 5. Phlebotomy complications. Phlebotomy variables. Now, despite all these strict protocols, drawing blood has some real-world physical stakes. The human body is complex, after all. The most common vascular complications are ecchymosis, which is essentially a bruise caused by a small amount of blood leaking into the tissue, or hematoma, which is a larger leakage. There's also something called iatrogenic anemia. This is literally physician-induced anemia resulting from taking too much blood for testing, and is especially dangerous in pediatric patients. And of course, we can't forget cardiovascular complications like syncope, which is just the medical term for when a patient simply faints during the draw. But beyond the physical complications, there are physiological factors that can completely scramble your blood data before you even step foot in the clinic. And this is fascinating to me. Did you know that just changing your posture from lying down to sitting up causes body water to shift, which concentrates larger molecules in your blood? Or that diurnal rhythms mean your iron and cortisol levels are naturally higher in the morning? Even stress can cause a temporary spike in your white blood cells. This is exactly why doctors insist you fast for 8 to 12 hours, because eating increases glucose and lipid content. Even smoking right before a collection elevates your white blood cell count and cortisol levels. Your lifestyle, your mood, and even the time of day are directly reflected in the chemistry of your blood.
We've journeyed from those strict 15-second hand hygiene protocols right through the precise 15-degree angle of a venipuncture, all the way into the calcium-stealing chemistry of the lavender tube. It's an incredibly structured, finely tuned scientific process. So I have to ask, the next time you're in that clinic chair, watching that little lavender tube fill up, will you remember the hidden complexity and chemical magic working to keep your blood alive for testing? Thank you so much for joining me on this explainer. Keep learning, and I'll catch you on the next one.